fourth part of the explained why series. Okay, let's discuss prolonged and regular use of purgative is undesirable. Why? Number one, it may cause dependence and habituation. Number two, because regular use of purgatives can lead to dependence on them to have a bowel movement, making it difficult to have a natural bowel movement without them, right? So they are dependent and making a habit. Okay, now disruption of gut motility of gut motility See, long term use of purgatives can disrupt the natural motility of the gut, leading to abnormal bowel habits abnormal bowel habits, constipation or diarrhea. Okay, and there may be cramping or abdominal pain. Okay, prolonged use can also lead to electrolyte disbalance. Okay, so imbalance. Okay, purgative can cause an imbalance of essential electrolyte like potassium, chloride, and like leading to muscle weakness fatigue and heart arrhythmias, right? Know about arrhythmias, right? Now there may also lead to nutrient deficiency. The prolonged purgatory lead to malabsorption of essential nutrients, for example vitamins and minerals, leading to malabsorption. Then there is gut lining damage to gut lining. Some purgatives can cause damage to the lining of gut, leading to inflammation and potentially even bowel obstruction. To avoid this, we say that use purgative when needed. Use purgative only when needed. Okay. Now choose gentle and not habit forming laxatives. Third is maintain a healthy diet and lifestyle. Okay, and consult a professional. Yeah. Okay, so this is how we describe how purgatives should not be used for prolonged time and not a regular year. Now, selective beta 2 agonist is the drug of choice for bronchial asthma. How and why? Right, first, it has a targeted action. Why targeted action? It has a beta 2 receptor present in your lungs, right? It is present in your lungs. So beta 2 is present in your lungs. Whereas beta 2 is present in the blood vessels. Is present, right? So now beta 2 agonist will be drug of choice in bronchial asthma because it is present in the lungs and bronchial smooth muscle. Beta 2 receptor is present in the bronchial smooth muscle, causing relaxation and bronchodilation. Okay. Number two, quick relief. As such, beta 2 agonist provide quick relief from symptoms like wheezing, okay, coughing, and shortness of breath. Okay, so provides a quick relief. It has low or minimum side effect compared to the non-selective ones. Okay, because beta 1 is present in the heart. Okay, so if a non-selective one is given, then beta 1 plus beta 2 will be there, so it will be causing problems, right? It has more side effects. So we give examples: salbutamol, terbutaline. Okay, these are SABA, short acting beta agonist, and there is formoterol. It is a LABA, it is a long acting. Okay, salmeterol. Salmeterol, formoterol, it's the long acting beta agonist, है ना. So why beta 2 agonist is used? Again, acute relief and low side effect and targeted action. Okay, now for chronic management, LABA are the drug of choice. Okay, now antihistamines are not useful for the treatment of bronchial asthma. Why? Number one, it has no significant bronchodilation. Okay. Number two, though relieving asthma symptoms are very less as compared to different beta agonists, right? Now, potential for sedation and dry mouth. Okay, sedation and dry mouth, which is not present in different beta agonists, right? Limited effect on airway inflammation. Okay, they target histamine receptor, okay, and which is not the primary mediator for asthma, acute inflammation in asthma, so they have a limited role. Okay, instead what we can give inhaled corticosteroid, because the steroids actually reduce the inflammation best, है ना, to decrease the airway inflammation. Then again, bronchodilators, for example beta 2 agonist. Then leukotriene modifiers, they reduce inflammation and prevent bronchospasm. ठीक है. So where actually antihistamines are used, अगर पूछा जाए, then it is used in allergic rhinitis, because it helps in the nasal congestion, runny nose, sneezing, okay, and also in anaphylaxis. In any emergency condition, life-threatening allergic reaction, anaphylaxis, it is used. Okay. Now it is important question of morphine again. It is contraindicated in bronchial asthma. Why? Because it is contraindicated histamine release. First you have to know about histamine release, because morphine causes histamine release, which can increase bronchospasm and worsen asthma symptom. Then it may cause respiratory depression. And this will be like asthma patient have already lung function compromised, and it will cause more depression. Okay, respiratory center में जाके depress करता है, so we should know about this. Now increased airway resistance. Okay, increased airway resistance, because like you have to understand, this will make the asthma patient to breathe more difficult, right? So there is an obstruction, it feels like an obstruction, right? So where even morphine, if used in normal bronchial asthma patient, the patient may turn this whole thing into acute severe asthma or status asthmaticus, acute severe asthma. Okay, or it may lead to respiratory failure. So it is morphine induced respiratory depression can lead to respiratory failure, in which there is need of mechanical ventilation. Okay, so instead of morphine, what can be used? Inhaled corticosteroids, systemic corticosteroids, and even for pain relief, other NSAIDs can be given, like even acetaminophen, paracetamol also can be given for pain relief, not morphine. Okay, so this is an important question. Now for oxytocin but not ergometrin is used for induction of labor. So ergometrin is used for oxytocin Oxytocin is very commonly used because oxytocin stimulates the uterine contraction, to induce the labor. Okay, it binds to the oxytocin receptor in the uterus, causing the contraction, right? Now, it is used for induction of labor, induction and augmentation of labor, augmentation of labor. Okay, in case of ergometrin, it is contraindication for induction of labor. Why? Why? Because ergometrin can cause sustained uterine contraction, lead to fetal distress, and complication during labor. Okay, this is important. Now, very important, it is ergometrin. You should know that it is used where it is used in case of PPH to reduce the bleeding and promote the uterine involution. Okay, so in for PPH, how it is, like it is a rapid action. There's a rapid action over there, quickly control bleeding. Second, it reduce the hemorrhage bleeding, and easy to administered, IV or oral, easy to administer. Okay, ergometrin is also contraindicated in hypertension. Okay, and in cardiovascular system, any problem, cardiovascular distress, any disease is there, तो complication बढ़ा देता है. So ergometrin should be used very cautiously for induction of labor. It is actually not used for induction of labor. Oxytocin is used, ergometrin is not used. Okay. Some other questions are also there. It is contraindication for controlling of PPH. We have discussed this. Ergometrin but not ergotamine. Okay. So for controlling of the PPH, ergotamine. What is ergotamine? Ergotamine is nothing but, this drug is used for migraine purpose. It is a vasoconstrictor. And it is not ideal for controlling the PPH. ठीक है, ergometrin में PPH में यूज करते हैं, it is not used. ठीक है, it is used for migraine, or it like it helps in controlling the effective migraine symptoms. Okay, so prostaglandins but not oxytocin is used for MTP, medical termination of pregnancy. So how the prostaglandins work? Prostaglandins like misoprostol or dinoprostone stimulates the uterine contraction, and cervical ripening, making them effective for MTP. ठीक है. Oxytocin, what is the like limitations of oxytocin? Oxytocin is typically used for induced labor in term pregnancy after 37 weeks. Okay, it is not effective in the MTP. Okay, because there the oxytocin response will be not there in the uterus as much as prostaglandins. The receptors are not ready, so it will be not used. Okay, so prostaglandins are used for medical abortion and for cervical ripening, whereas oxytocin is used for PPH. ठीक है, थोड़ा बहुत, ठीक है, ergometrin से कम obviously, but there is there, and labor induction. Okay, now folic acid is not administered alone for the treatment of pernicious anemia. Okay, because it will cause masking symptom. It may cause marking symptoms. Folic acid masks the hematological symptoms of pernicious anemia such as megaloblastic anemia without addressing the vitamin B12 deficiency. vitamin B12 deficiency. Number 2, progression of neurological damage. Neurological damage. If left untreated, the vitamin B12 deficiency can lead to irreversible neurological damage, including the neuropathy, ataxia, and cognitive impairment. Okay, this is the triad of neuropathy, ataxia, and cognitive impairment because of vitamin B12 deficiency. Okay, so this though alone vitamin folic acid, vitamin B9 is not given. We have to add vitamin B12 also. Okay, so this pernicious anemia is treated with both. Mainly it is vitamin B12. Okay, for vitamin B12 you have to also know that it contains cobalt and it is used in the cyanide poisoning. Okay, with the with the cyanide kit we have a vitamin B12 injection. Okay, so if you use folic acid alone for the question, it will lead to delayed diagnosis and irreversible damage and delayed diagnosis. Okay, so not used in leukemia, right? Folic acid should not be used in leukemia, especially actually megaloblastic anemia due to folic deficiency. Again, it has an leukemia. If saying folic acid will actually interfere with methotrexate. Okay, the chemotherapy which is used in leukemia, methotrexate interference is there. Okay, so it is actually used where to methotrexate toxicity and to treat folic acid deficiency. So it not be used in leukemia because it acts on the methotrexate also in leukemia patient. If there is a decrease in vitamin B12, okay, it will show the masking effect as discussed before. Okay, so let's make some more questions. Okay, discuss some more questions, then we'll switch to other video. Okay, so hydrochlorothiazide is effective for the treatment of nephrogenic diabetes insipidus. This is NDI. Okay, because it is a very classical question and this MCQ is very thoroughly asked and everyone has a doubt about it, because hydrochlorothiazide has a paradoxical antidiuretic effect. The hydrochlorothiazide is a thiazide diuretic. Okay, it has a paradoxical effect on it. It reduces the urine volume and increase the urine osmolality. This you have to understand. This is a paradoxical antidiuretic effect. Number 2, enhanced sodium and water reabsorption. Hydrochlorothiazide increases the sodium and water. See, sodium जहाँ जाएगा, water it will go follow it. ठीक है, in the proximal tubule. ठीक है, reducing the water delivery to the distal tubule and collecting duct. ठीक है. Number 3, it actually decreases the urine output, so it helps in polyuria. It actually helps in polyuria. It decreases the polyuria, okay, which is the main symptom, hallmark symptom of diabetic insipidus, that is the polyuria. It acts against the polyuria. Okay, so this you have to know. And withdrawal of glucothyroid therapy should not be done suddenly, abruptly. तुरंत नहीं बंद करना होता. Why? So this is again a very important. Explain why. Because of adrenal insufficiency. Sudden withdrawal can lead to adrenal insufficiency. The body natural cortisol production may be suppressed. Okay, the HPA axis actually decreased. So we have to know that adrenal insufficiency is there. There may be rebound inflammation. Stopping glucocorticoid therapy abruptly causes a rebound effect, leading to increased inflammation and worsening of symptom. Okay, and there is a risk of Addisonian crisis. Sudden withdrawal can precipitate Addisonian crisis. Okay, and it is a life-threatening condition in which severe hypotension is there. Hypotension, dehydration, and electrolyte imbalances, right? To avoid complication, what we have to do? We have to do gradual tapering. ठीक है, we have to do monitoring. ठीक है, तो gradual taper the glucocorticoid dose over a period of time, usually weeks or month, to allow the body to adjust. ठीक है, time दे रहे हैं. Monitoring, closely monitor the patient symptoms, blood pressure and electrolyte during the tapering process. Okay, and we can give alternative treatment like NSAID or immunomodulator. Now, combined OCPs contains both estrogen and progesterone. Suppose, let it be the last slide before the next particular explain why. So, combined OCP contains both estrogen and progesterone because it has an estrogen component. It inhibits the ovulation, reduces the menstrual bleeding, and it provides contraceptive benefits. The progesterone component, levonorgestrel, norethindrone, ठीक है, levonorgestrel, norethindrone. In estrogen, it is the second one, estradiol है ना, triol नहीं, diol नहीं, 2 वाला. ठीक है. Now progesterone में it thicken the cervical mucus. ठीक है, preventing sperm entry. Suppose it also supports the estrogen part, ठीक है, in inhibiting the ovulation. Okay, so the combination is actually a positive one. It enhances the contraceptive efficacy. ठीक है, so the combination helps to enhance contraceptive and regulate menstrual cycle, and also it has non-contraceptive benefits to reduce the ovarian and endometrial cancer. Okay, so this you have to learn a lot about estrogen and OCPs, estrogen, progesterone and OCPs. I think this is a summary. Okay, so these explained whys are very important. Okay, and one more video I think will need it to complete the whole therapeutic problems as such.